Hello, I'm going to give a quick overview, a very brief overview of Chapter 1 and Chapter 3. I'm going to start off here. So let's go ahead and get started and hit what we're going to be covering in this class. It's going to be Introduction to Public Health, and I'm going to follow with Chapter 3. So when I talk about public health, there are basically three big things that you need to think about. Protecting the health of entire populations. So public health looks at the whole entire population. Health promotion, surveillance, monitoring. It looks at analyzing the outbreaks of epidemics, diseases, disease prevention, and then it communicates to the public. They're very much into preventing problems before people get sick. And they're very much into promoting healthcare, equity, equality, and making sure people have access to healthcare. So there are basically three different types of prevention. And if you think about it, the first is primary. This is preventing illnesses or injury before they occur. So, for example, can you think of one? First thing that comes to my mind is immunizations. It's preventing something before it happens. Seatbelts is another example. Secondary prevention looks to minimize the severity of the illness or the injury. So it's reducing the impact. It's stepping in, let's say someone's been diagnosed with prediabetes or is about to become diabetic, actually changing their diet and looking at how they can bring their sugar levels down to decrease the risk. And then tertiary prevention is really stepping in and doing interventions that actually get people back into being healthy and functioning. So one thing that comes to mind is, for example, a diabetic, again, who has sugar levels that have gotten so high that they have had to be hospitalized. So tertiary prevention goes in and actually intervenes and works to rehabilitate. When I talk about the chain of causation, that's a big thing. So it's along the same lines of primary, secondary, and tertiary prevention. It's trying to figure out how to break a disease in its pattern or break an injury in its pattern so that people can stop the cycle of it impacting a population. So let's think of a disease like a person would be a susceptible host, okay? The infectious agent would be something, one of the pathogens like bacteria, viruses, fungi, one of those, and we'll be talking about those in the infectious disease. Finding out where the infectious agent is. So, for example, with rats, they actually carry fleas that carry the bubonic plague, or you'll have water that's standing that has mosquitoes in it that carries diseases like the West Nile virus or malaria. And so you start to figure out where this is. Then it's where it can go from a human, and reservoirs can also be humans too. I mean, think about it. People who have the flu, carrying that disease from one person to the next. Then it exits the person, let's say sneezing or through feces that, like, for example, hepatitis A, passing from fecal matter like feces onto hands and into the mouth, blood, open sores, and then the mode of transmission. It can actually be ingested, it can be airborne, and then the disease goes. So in public health, they're very into breaking that cycle. They don't look at the individual. They look at where the disease is in this cycle. So one of the big things is tracking diseases. What diseases are of serious concern? Do we have an outbreak of syphilis? Do we have high chronic diseases like heart diseases? Do we have more diabetes? So what public health does is they create these databases that they use. And if you click on the PowerPoint when you download it, you can actually click on one of these and look up and actually see where we rank, or you can look up in kids data. So what I'm going to do for one of the assignments for those people who are not present for the hybrid, I'm going to ask you to jump into this PowerPoint and tell me what you can find on one of these databases. So we're constantly looking to see how we're doing as a population. And then we look at Kern County. And what you need to know is that public health concerns are huge in Kern County, which I find it ironic. Let me get on my soapbox for a second, is that we do not have a public health program here in Kern County until now. This is the first time we've had a public health program where we actually have classes and a degree because the need is great here. If you go out in the public health community, there are a lot of jobs. There's a lot of things that can be done, and you can see that we have higher rates of smoking, obesity, excessive drinking. Do you know that we have some of the highest rates of sexually transmitted infections in the state? We have high rates of syphilis, gonorrhea, and then for the teen birth rates, we are going back and forth for being the highest teenage pregnancy in Kern County. So when you go out and you look it up on, click on one of those databases I provided, you're going to find that you could look up teenage pregnancy and you're going to see what our rates are. So we're very high. So this is what it looks like, and you can see Marin's number one. And I'm going to tell you that if you live in Marin, the chances of being healthy are higher than if you live in Kern County. So you could see our rates, and you can click on this and you can see the rates, and it can actually show you the trends. These are the jobs. So for example, one of the jobs that people can have is be an environmental technician, where they go out and they test water and actually see how it is, where they have lead levels. And see, lead actually interferes in the development of a child, and we'll be learning about that. But Kern County has higher rates of that too. So you have to understand, we have environmental things that actually can make us unhealthy. These are the different disciplines that you can get into. Epidemiology is the study of diseases, and next week I'm going to have an epidemiologist in my day class, and I'm going to post that. So if you want to show up during the day class and listen to an epidemiologist, you can. I also will be posting some snippets of her presentation, so you can see what it is that an epidemiologist does. They study diseases. And these are the different types of disciplines that you can go from epidemiology all the way to health policy and management. Here are the jobs that are out there. So when I told you that Kern County has some of the worst rates, you also have to understand that there are many jobs that are addressing these rates, from environmental health, health administration, public health informatics. Those are people that are using data. And then a health educator is someone who's actually educating and going out and doing health promotions. So I'm going to highlight each one of those jobs now. An epidemiologist, I talked to you, but this is what they call the shoe leather detective. This is the person that's on the ground trying to figure out where the disease started and how to stop the spread of the disease. And that person, Kim Hernandez from the Public Health Department, will be in my class next week to talk. Here's what the median pay is for an epidemiologist. They need a master's degree, but you can also get a bachelor's degree and start getting to work in this field. So if you're interested in an associate science transfer degree in public health, realize that this is a track that you could possibly look into. You need to be very strong in statistics in public health. So these are all the different things that are really important, from collection of the data on the population to really knowing how clinical studies test how it works, whether something is really effective or not. And this is the median income for a statistician. So when the epidemiologist comes into our class during the day class at 11:10, and I'll give you the date, I'll be posting the date, you're going to see that she has actually a background in statistics. So when you see that the associate science transfer degree has a strong statistics in it, it's because you use a lot of statistics in public health, because you have to see what the diseases are and to track them. So the other branch of public health is infectious disease, pathogens. These are disease-causing agents. So control of infectious disease was a major public health focus in the 19th and 20th century. And I'm going to be going over what that entails next week. We're going to be diving into infectious disease. And if you read the first chapter, you're going to read about how tuberculosis was a big concern, the advent of antibiotics, how we start to control chronic disease, and how genetics have to play with it too. But probably the biggest indicator is where people live and what they're exposed to. But anyway, that's biomedical sciences. That's a branch of public health. The environmental health science is huge. This is the one that does the air quality, the water quality, the solid and hazardous waste. They focus in on making sure that our food is safe, that our drugs are safe. So I will be highlighting, we'll have chapters on that. Chapters 20, 21, 23, 24, you could see in the book, we'll be covering environmental health science and what they do. And some of the things that we need to worry about here in Kern County, or some of the things that are good that we have going in Kern County to help keep us healthy. And this is what their job range is. This is an environmental science technician. They start at $41,000 per year. But you need to know that if you get a degree, if you get a bachelor's in this, that pay doubles and it goes up into the $80,000. So, and then it increases as the more education you get. So, really important to see that as you get more education in public health, the more your career trajectory and pay goes up. And this is the one I'm very familiar with is social and behavioral sciences. This is looking at how people, what behaviors they have that impact their environment. So tobacco, poor diet, physical activity, where they live, the fact that certain populations have lower life expectancy than other populations. Even looking at our community, for example, Oildale, Kernville, and the Taft area, I remember correctly. Let's see, Oildale. Yep, those three areas have lower life expectancy than other areas. So it's looking to see why are some populations having lower life expectancy than others. This is what a health educator does. They go from anywhere from talking to someone individually to working with school children to working with law enforcement. I've worked with law enforcement in the past to do DUI education. And you could see that we need to do that because like you saw that stat in the very beginning, 33% of our driving incidences are related to alcohol in Kern County. So we definitely have issues here. Nutrition. So all these are all things that a health educator tackles. Car seat education. How to put in a car seat. You know, for a child, their chances of living through a car accident, they're four times more likely for a child if they're ejected to be killed. The leading cause of death for children, all diseases combined, everything are injuries. That's the big thing. And motor vehicle crashes is the leading cause within injuries for children in a certain age group. So definitely trying to get that out there. And let's not forget health policy and administration. They play a role in public health. They really help out with getting access to health care. And they have some of the highest paid jobs. They could typically go over up to 94,000, but they can go up to 100, even to 200,000. And then let's not forget public health and emergency preparedness. All the emergency management systems, everything that when we have an earthquake, we have a disease outbreak, it's constantly working with your agencies to help protect us and keep us safe. And this is what their job earnings are. So occupational safety is a big one. They're typically at 55,000, but again, if you partner up with environmental health, that can go up to 80, up to 100. It really depends. This is one of the career ladders that I pulled from the Kern County Health Department, where it goes. You can see that how the pay goes from 15 all the way up to 31. And this is hourly rates. You could see as people get more education, the rates go up. So I'm not going to push this obviously on this, but I'm going to ask in the discussion what kind of careers that you're interested in your assignment too. If you did not attend the hybrid, you're going to see this pushed out. And one of the big things I mentioned, and I want to make sure you know the difference of, and is that we're going to really cover the difference between public health versus medical care. So public health and medical care, the medical model are two different ones. Medical model looks at the individual patient, while in public health, they look at the whole entire community. The patient is the community. It looks at diagnosing what the disease is in the community, so you can see why disease trends are really important. It does the treatment, could be developing a new policy and creating an intervention, like removing all the sugary drinks from a school, or having a no smoking policy. So the goal of medicine is to cure. So you want to cure someone, treat someone, make them better individually. The goal of public health is to prevent a disease and prevent disability or injury before it even happens. So it's interesting, only 3% of the nation spends money on public health. We're very focused in on treatment. This might be part of the reason why we have some of the highest healthcare costs in the world. Actually, we have the top. It costs more here to get treated medically than anywhere else in the world. So we spend a lot of money on treatment and not much on prevention. And the life expectancy of America has increased by 30 years over the next 20th century, and only 5 of the 30 years are attributed to modern medicine. So the biggest thing that really changes and makes people healthier are social reform efforts, are actually doing policies changes and improving the well-being of people. So here's the big things that you're going to hear about. Assessment is really taking statistics and looking at it and making sure that you can analyze things. Policy development looks at developing policies and putting them into place. And assurance is actually making sure that these policies are actually done. So having, coming back and doing inspections, having law enforcement enforce things. So I'm going to ask you to take a look at this as public health. I'm going to post a video, and then I'm going to actually have you have a look at the Facebook and the Twitter page. So check those out, okay? And see what's going on within public health. Every week I post jobs and things that are going on. So let's go on to the second PowerPoint. And the second one I'm going to be talking about just the powers and responsibilities of government. And then next week, I'm going to have a field trip to the health department. And I'll be posting video there. And I also will post you the time if you want to join in on the face-to-face class to go see the health department. So basically public health actually has policing powers. Do you know that the health department can actually establish a quarantine and that they have the ability to shut things down? They could shut borders down and they could shut schools down. So they have the ability to stop things before anything can spread or before someone can harm themselves. So that's important to know. Public health has policing powers. I want you to know the difference between the federal and the state. So federal focuses on, there's a U.S. Constitution, which basically says the 10th Amendment pushes the power to the states to really, really control public health issues. But there is definitely a role between the state and the feds. Federal government is the U.S. government. State government is our California government in this case. So the federal, they're in charge of things that go across all the different states. Food, Drug Administration, the ability to tax across the United States. And 50 to 80% of funding comes from Medicaid. Have you heard of that? Medicaid, Medi-Cal. This comes to give healthcare to those who cannot afford or make certain poverty levels. And so if they meet certain poverty levels, they get access to healthcare. So so it limits Congress's power to actually do things. It's the states that really have that power. And so we have federal, state, and local. So legislative passes statutes. These are laws. And then executively, then the laws come down to the public health agencies who are charged with carrying out the law. So as these public health county agencies and everything else that you see out there, they have a law that gives them the teeth to do what they need to do. And then judicially, we might have laws and regulations that can be challenged in court, or we can say, we can make challenges to those and do things locally to circumvent it. So for example, in California, we had we legalized marijuana as a state, but locally we went to our county and we decided to do something to do an ordinance. Now, someone could challenge that in the court. So things constantly are established with laws and ordinances and court orders. So it really becomes about, if you can think about it, policy, health policy is big because the policy gives the teeth for us to be able to do things. So OSHA, look at page 29 and take a look at that and see the OSHA example. And on page 29, you could see that this is a perfect example of a law that went into effect, and where they brought down the parts per million for let's see here, for benzene, which causes leukemia. And so so they reduced that, and then it was challenged in court, and you can see it goes back and forth. One of the big things you need to realize is that when a law comes into effect, people have to enforce it, and so it takes money to enforce it. So let's say, again, back to this marijuana law passing, now the health department is charged to enforcing that. And then people can fight over it, and laws can change based on that. So look at page 29 to see that example. Here, also next, look at the public health department. I want you to snap out, check this out and look at what their big areas are. So they're in charge of keeping all the vital records. They're in charge of infectious disease, environmental programs. So you can see that they're in charge of these different areas. And really at the local level, that's where the rubber hits the road and people can really make sure that we're keeping our community safe. At the federal level, when things go across the different states, that's when they jump in. So for Center for Disease Control, if we had an outbreak of a disease that started here, they would report to the state level and to CDC, who would then start to do education across the states. How about if we had something tainted drug that came out of, or food that came out of a state on the East Coast and coming over to here, they would communicate it and let the local health department know so that we could get the message out. The State Department is that reporting mechanism, so the local would report back to the state and the state back to the local. So it's all about getting messages out to the different communities to make sure that people stay safe. And so this is all the different things that go under the state. And so you can see that they're in charge of things like infectious disease and chronic disease control and maternal and child and adolescent health. These are areas that they're in charge of. So there's definitely a state function. What I'm going to ask you to do is I'm going to ask you to click on these different websites. You will need to know these different websites and what these agencies are. So if I told you asked you what the Department of Health and Human Services are, would you know? CDC, NIH, FDA, CMS, AHRQ, IHS. So I want you to just tap on these, take a moment, tap on these different URLs and become familiar with these federal agencies, because knowing who to call and who has responsibility for things is a very important function of public health. See, and these are all the others. I'm not going to list every single one. So tap on them and see what it's about. EPA, OSHA, USDA. Go ahead and check them all out. See, here's a perfect one. USDA is looking at a new antibiotic approval for treating bacterial honeybee diseases. And some would argue that the use of antibiotics in our food supply causes problems. So the USDA will actually start to look at that and start to see, is it safe or not? I want you to also look at morbidity and mortality weekly report. This is probably the key thing that everyone looks at every week to see what the diseases are across the nation. So check that out. This is where AIDS was first reported, and then the newspapers picked it up and then told the world. Okay, check out National Center for Health Statistics. Check that out under CDC. Check out the NIH, drill down on that. And then I have to end with non-government public organizations. So the feds and the states can come in emergencies, or they can come in and they can step in. But it's the non-government organizations, what they're called NGOs, that really kind of step in and fill in the gaps. So if we had an earthquake here, we would have the emergency response office here take over. We'd have Center for Disease Control. We'd have our state come in, and money would come in to support us locally. But the American Red Cross would be the one setting up the shelters and working on really filling in the gaps and helping with people. So non-government associations really do step in. And then, of course, we have foundations that give money. That also helps too, and that helps fill in the gaps. So if you had to right now just kind of test yourself out, could you think of a specific health problem and be able to apply it to the federal, state, and local levels? And then would you be able to say the feds would be in charge of this, the state would be in charge of this, and the local government would be in charge of that? So let's see, I took the example of an outbreak. Let's take an outbreak of Ebola virus. The CDC would be the one making sure the communication would get across the whole entire United States so they could contain it. The state would be in charge of really focusing in on talking to all the different counties and health departments to get the information out. And at the local level, the county would be going out and getting all the information, knocking on doors, setting up quarantines, collecting the samples to send up to the state. Do you see how that all of a sudden each person has a very specific role in an epidemic? Drilling on their websites will help you to understand how each would tackle a problem. So can you also look at one of the websites and see if you can pick out one issue that they're currently struggling with, okay? And what their big charge is. So for CDC right now, what is the big thing that they're focusing in on? And then lastly, can you figure out a non-governmental organization that you think could step in? So can you name one right now? I mentioned the American Red Cross. Can you think of another one? How about the American Cancer Society? Or the Epileptic Society? Or and a support group for setting up a whole cancer awareness group, or outreach around diseases that are very specific, like ALS. So you could see that there's a lot of different non-government organizations that step in and they provide more of a social support and network for people on the ground. Okay, great. So that's the end of this slideshow. And basically what I want you to do this week, I'm going to come back out. And what I want you to do this week is that you should be at the point, and I'm going to go ahead and I'm still screen sharing. I'm going to go ahead and take you to the website, Inside BC. I'm going to be posting a discussion item for those who did not make the hybrid class last night. You need to respond to it to get the credit for that. And also, I want to make sure that you actually are following up right along. So go ahead and sign in and go to your modules. That's my phone ringing. Let me bring it down. Go to the modules, and I'll be posting it in this item right here in week 1. If you have any questions whatsoever, I would like you to give me a call, Canvas message me, Google. I'm going to be pushing this more to an online format and less a hybrid format. So I want to make sure that you all stay in the class and we work together to make sure that you get all this information. I also will be posting all the field trips so that if you want to jump in, you can. And you're always welcome to come to my Monday, Wednesday class at 11:10 a.m. in Library 149. I'll be posting that information also. Have a great week, and I look forward to our weekly, my weekly post and our discussions.